First slide. Okay, so let's start. Today, our topic is the diabetic foot care. Good morning, good afternoon, everybody. I'm the speaker today, Chu Wai. You can call me, just address me as Chu. So diabetic foot care, as everybody knows, the prevalence of the diabetic has increased in the worldwide lately, and those diagnosed with diabetics have increased the risk of developing diabetic foot. Therefore, this is very important to provide patient educations to the patients in order to prevent in the developing of diabetic foot and its complications. Before we go further, we need to know what is diabetic foot. Diabetic foot can be defined as foot in diabetic with neurologic disorder, some degree of vascular involvement with or without metabolic complication of diabetic in lower extremity and prone to infections, scarring with or without deep tissue damage. The causes of diabetic foot mainly is due to two problems. That is peripheral neuropathy, which is causing loss of sensation of the foot, and peripheral artery disease. The other causes may be due to uncontrolled hyperglycemic and the pre-ulceration lesions, such as the callus. According to the statistic, there is 85% of non-traumatic lower limb amputations in diabetic patients are preceded by a foot ulcer. And 15% of patients with diabetics will develop foot ulceration in their lifetime. So what is the sign and symptom of foot problem? Let's look at the pictures. The picture is so very clear. These pictures is showing the patient have the changes of the skin colors. It's look pale. And when you touching on the patient leg, you will feel cold on cold on touchings. When you palpate the pulse, maybe you will feel that it's a very feeble pulse. And this is not a good sign of the foot problem. The other pictures, which is showing here, this is a sign and symptom of foot problems. That is a blister, also maybe some infections is going on and will cause maybe ulceration later. And the corns, they look normal. But if we never notice that it's corn under the face, it may become infected. And there is some calluses as well. Infected toenails also is a sign and symptom of foot problem. Other than that, if the patient develops some swelling odor, we have to beware of that. There is a significant sign and symptom of the foot problem. But how about what the diabetic foot can create other complications? The complications, like the picture we can see here, is the neuropathic foot ulcer. The foot ulcer is untreated, it's getting severe. This may become a small gangrene, and maybe we need to think about the amputation like the other picture shows. So this is a diabetic gangrene. And this picture, the great big toe have been cut off, but the necrosis is still spreading. It's not treated that well. And they might have a foot deformity from the diabetic foot complication. And this is, of course, is a toe amputation and is still ongoing, the ulceration. Abscess also is one of the complications. The another ones is maybe it's quite rare. We will see in our lifetimes, there's diabetic Charcot joint, or called diabetic Charcot foot. Okay, so in these pictures, in this one, this is about the diabetic foot risk stratification, which we use in the management of the diabetic foot. The risk stratification is for us to identify the diabetic foot risk. The best one, of course, is the normal one. There is no abnormality. But when we develop the complication of diabetic foot problem like this one, that's considered as active diabetic foot problem. This is the most high risk. So we need to get treatment immediately. Now we go to the most important part, that is the management of diabetic foot. The management of diabetic foot actually divided in 4 elements. That is assessment, referral, prevention, and the treatment. In the assessment, it's a normal duty job for healthcare professional to do. When the patient first come into the clinic or come into the hospital, the first thing we would do is assessment. We need to do from the head to toe assessment thoroughly. But in the diabetic foot care, we need to pay more attention in the foot examinations. Foot examination is supposed to do at the diagnosis and repeated at least annually for low-risk patients or more frequently to the high-risk patients. What we would do for the food assessment, the most common ones we can suggest to do the Weinstein monofilament test, like this one, to check for the neuropathy, peripheral neuropathy. And while we need to detect the patient whether have a peripheral artery disease, we need to use the most simple way, palpations for the pedal pulse. If the pulse is really feeble or due to the swollen leg, we can, with the help of the CWD, continuous wave Doppler. Other than that, we need to assess for the skin change and any structural deformity. Of course, we need to check the patient diagnosis. We need to ask the patient about what's your history. Is it your family member have any diabetic? Or do you happen to have any sign and symptom of diabetic before? Last, we still need to send the patient to do some investigation. FBC, renal function profiles, and the most important is HbA1c, fasting blood glucose, ABS. Of course, imaging as well, chest X-ray if you found there is some abnormality on the face. After we do all these diagnostic tasks and assessment, we need to identify the patient risk stratification using this diabetic food risk stratification to identify the risk. And we can as well to use the classification of diabetic foods using these walnuts diabetic food classifications to identify the patient problem. If you found the patients have some active or complicated food problem, definitely we need to refer to multidisciplinary team. It's not limited to nurses, but we can refer the patient to diabetic food nurses, wound care nurses if there is a wound, dietitian to control their diet, refer them to endocrinologists, orthopedic. Of course, if there is active infection with positive wound swab result, we need to refer the patient to the infection control team. The third element in the management of the food diabetic foods is the prevention. And this is mainly for the patient education. This is the most important part. For the patient education, we need to give to the patient and the caregiver at least annually or more frequently in the high-risk patient about the basic care of the food. Like these pictures, it's very easy to remember it. We need to wash the foods daily with lukewarm water and mouth soap, dry them carefully, especially in between the toes, cut the toenails carefully, avoid overheating on coal, and you can inspect the feet with a mirror if you're unable to do so, and wear the socks and avoid barefoot. Preventive footwear is very important here. We need to choose the shoe which is comfortable, covers, and fit with your feet. Okay, we need to change the shoes daily if available for distribute the pressure differently. And normally we will advise the patient to buy shoe in the late afternoon because by that time our leg maybe will be swelling. That is the best time to get the best shoes. Of course, in the prevention, metabolic control is very important. We cannot let the hyperglycemics go uncontrolled and getting more and more complications due to the diabetes. Before we except to control the hyperglycemia, we also have to minimizing the hypoglycemic because some patients, they might thinking my blood sugar is uncontrolled, I need to take more insulin or I need to take more oral anti-diabetes drugs. So they will take, but without taking more food, they will tend to have the hypoglycemic also is not good for the patients. If worse come to worse, the ulcer is not good, that is developed the diabetic foot complication, we need to send the patient to do some percutaneous tenotomy. There is one kind of the prevention as well. Last element of the management of diabetic foods is treatment. If the patient develop pain, we need to give analgesic for the patients to solve their pain problem. If the patient develop active infections in the foot, we need to provide antibiotic based on the wound swab CNS result. Last part, we will go to the wound management. They're divided into 3 parts. There will be non-surgical and surgical intervention as well as rehabilitations. If patients that have a small cut on the face, we can provide a basic dressing, just cover with the dry dressing. If there is no worse of the wound, what we can do, we can give them a advanced wound dressing. Depend on what the wound care nurse suggests, we might use some hydrogel or alginated dressing. If it's still not helping with the advanced wound dressing, we can consider about the adjuvant therapy, like negative pressure wound therapy. This is a negative wound therapy, a negative pressure wound therapy. And we can use the maggot debridement. I'm sorry, I didn't put the maggot debridement picture here because it's not so nice to have a look. And of course, we can send the patient to the hyperbaric oxygen therapy if that is possible in your place. If it's still uncontrolled with the non-surgical intervention, sorry, sad to say that we need to send the patient to do some surgical debridements and maybe reconstruction surgery like the skin grafting. If the patient have the PAD problem, we can suggest the patient to do the revascularizations. Of course, at last, for those patients who happen to have an amputation, we need to refer the patient to the physiotherapy for post-amputation rehabilitation. For those who have active ulcer, we can suggest them to have a offloading footwear like this one, total contact cast, or this padding. This is the therapeutic footwear tapping is offloading padding. Finally, we shall not forget to continue monitor and follow up the patient foot conditions. Frequency of monitoring of patient with diabetic foot depends on risk stratification, such as a low risk. Maybe we can follow up with them at least 1 year per time. At least 1 time per year, or we can follow up with them 3 to 6 months for moderate risk. And training caregiver also is very important because not all the patients know how to take care of themselves. As a conclusion, how can a healthcare professional, including nurses, can be assisting in preventing of diabetic foot complications? Perhaps effective patient education is the best answer. And nurses play a very important role in the patient education teaching because we are the ones spend more time than other healthcare professionals because we are the ones who stay more time at the patient bedside for observation, for assessment, for treatment, everything. So nurses play a very important role in the patient education. That's all my presentation.